So, hi, good afternoon. My name is Charlotte, and I am the program coordinator for the Center for Connected Multimodal Mobility. And we want to thank you for joining us today. With most of our presentations, feel free to put any questions in the chat or raise your hand, and we'll select it for you to go ahead and speak. Or if you want to wait, and we'll have a question and answer session at the end, and you can just ask your question directly to Dr. Brown. With that being said, I want to introduce our center director, Dr. Mashrurani Chaudhry.
Hi, welcome everyone to our CPS series. We are very lucky to have among us Dr. Kweku Brown. He's actually was my student. He was our graduate student at Clemson. And I'm very proud. He just was promoted to being an associate professor in civil and environmental engineering at the Citadel. I just heard that from the chair of the department. So Dr. Brown is a member of both the National and the South Carolina section of the ITE. He is a current member of the TRB Committee on Geospatial Data Acquisition Technologies and a former member of 2 TRB committees, Geospatial Information Science and Applications and Statewide Transportation Data and Information Systems. Dr. Brown is very active in engineering education, professional organizations, community engagement, and has represented the Citadel at national capacity building workshops. He works on South Carolina Department of Transportation sponsored projects on safety, access management, and traffic operations. Additionally, his research focuses on transportation safety using geospatial analysis, transportation health and built environment, as well as engineering education. We are glad to welcome Dr. Brown to be our speaker today. Dr. Brown, thank you.
Thank you, Dr. Chaudhry and Charlotte, for having me. It's definitely an honor to be part of this series. Can I share now, I guess, Charlotte?
Yes, you should be able
to. Switch this. So welcome again. The topic that I'm going to be talking about is assessing the potential of bike share networks and active transportation to improve urban mobility, physical activity, and public health outcomes in South Carolina. This was done mainly in Charleston, but we're looking to be able to replicate this elsewhere in the state and in neighboring states. The main funding source for this project is the C2M2 Center, and has been the driving force for this research. So as an overview, the outline will be starting off with introduction and overview, the data and analytical methods, some of the bike share pattern uses that we found, street network evaluation and utilization, some of the physical activity benefits, and research takeaways. I'll be introducing the team next. We have Dr. Davis as the PI, who is actually on the call from the Citadel. And then the physical activity and public health side of the research was spearheaded by Dr. Morgan Huey from College of Charleston, Dr. Bornstein, and also Dr. Kaczynski from South Carolina. University of South Carolina. And then the rest of the team includes myself, Dr. Mikalaka, and Dr. Hun from University of South Carolina. So it's a broad team from the different participating universities in the C2M2 Center, which actually leads me to the slide talking about the center and Clemson being the lead universities and all the different collaborations that we have in the center. So to start off, I will go through some of the data that we collected over the time period and the analytical methods that we used. The main data source for our research was from the Holy Spokes Bike Share Network, which is run by the Garcha Mobility by both organization. We've been able to develop a strong relationship with this group and this stakeholder, and we're able to get access to some of the data that they have from their dashboards and even further. So we did this analysis for April 2018. The main parts of the data sets that we needed were actual locations of bikes. So these bikes have been fitted or equipped with GPS units that track the movement once a ride has been started, and we're able to get access to that data. So that was one of the most important data sets we needed. So these points actually have latitude and longitude locations and are logged every 10 seconds thereabouts. Some might be a little bit less than 10, some are a little bit more, but on average about 10 seconds. So we're able to get about 800,000 GPS points over that time frame, that month in April 2018, and approximately created about 5,600 bike routes with unique trip IDs. So how it works is the user would start a session or start a trip, and the trip ends when they kind of dock the bike back into the docking station. So you could have multiple trips by the same user in the same day if they actually unlock the bike more than once. So those are some of the things we're looking at. So here's an example of how the GPS points were geocoded and how it looks. And you can see it's a large coverage of the peninsula in Charleston, and kind of running everywhere, all the way from the north to the south, east, west, kind of covers most of the peninsula. So just a sample here. To look more closely, you can actually see where people are actually riding. Some would be in the street, some on sidewalks. So the locations were pretty precise. That actually tells you where people are actually riding, and that's what we wanted to get into, the actual details. So these points the lines were created from the points. So these lines represent the actual routes that were taken by each of these users of the bike share. As you can see, there were some issues. As you can see, some lines crossing over building tops. With any system, there's always going to be issues with data, and we had to clean up some of the data just because of that, some of these issues here. All right, so looking at the data we used, some of the methods, now we're going to look at some of the patterns that were emerging when we looked at the data as a whole. So this is a graphic here shows all the bike routes that were created from the GPS points over that time frame, and you kind of notice a few things which are typical with bike riders. Not always going to be on the roadways, right? Some will be cutting corners. For example, this was really interesting. That's why I kind of put it in here, where you have I kind of circled this spot here where you have folks avoiding the intersection, which makes sense if there's some kind of bypass that they can take, right? And it happened pretty often throughout the data that we're looking at. The next slide also talks about some of the other patterns that we kind of found out or probably knew, but it's pretty clear now from the graphic, where we're looking at Hagood Avenue here in Charleston and Courtenay Drive. And the main problem with this picture here is this road right here is very busy, and it's not conducive for pedestrians and bicyclists to cross. But then these bicyclists are kind of captive in that moment where they're coming down Hagood, and there is no other option but to cross this road. So you can see that some kind of cross right at the intersection, some kind of turn left, try and cross here, and majority are crossing right onto Courtenay. So this was some of the things we're trying to identify and also bring to the attention of the city, which I will talk about in a little bit. here. The next slide, it's actually showing a waterfront park, which is where most of the tourists are more in the touristy districts near the waterfront park and also the battery. But this one is for the waterfront park. One interesting thing was looking at these lines here in the upper right corner is basically having someone on a bike going onto the ferry, which was pretty interesting. So I just decided to put that in there. And I'm making a trip back or actually going on and riding on the other side or wherever the destination was. So the GPS tracking was pretty good and it tracked all the way until you actually docked the bike. Right, so these are some of the patterns that we're identifying and were pretty clear. So what was the next step then? So we had all these routes, but we're actually looking at the infrastructure. That's kind of the purpose, to kind of see how everything ties into the infrastructure here in Charleston. So to do that, we aggregated these bike routes by segment, roadway segment. So this is the peninsula. And these are all the different roadway segments on the peninsula with aggregated bike routes, right? So what does that mean? It means that each road gets a count of how many times a bike passed on it during that time frame that we looked at. And these have been color coded. So it's a thematic map of color and also of size, right? So it's a scaled symbol map. So the bigger the line, the more bike traffic or bike passes, if you want to call that, or counts. And then the color also depicts the same thing. So from green to red, it's getting bigger in that sequence there. So then we kind of see more patterns emerge, more quantifiable patterns to be specific there. The tourist areas where people come to look at more are highlighted in red, yellow, kind of down on the southern side. But there are some other patterns which I will get into that are highlighted by more of the local users than the visitors. But down at the bottom, it kind of sticks out, and you can see that most people are coming to the battery or the waterfront as tourists. So leading into this, I did mention local users. So we split up the bike share users by local users, which is indicated in the membership type. So for those that have maybe monthly passes or yearly passes, and also work with the medical university, because the medical university has collaboration with the bike share to have their members or their workers have memberships. So then we're able to split up the local users the best way we could from the membership type, and then all the others that have, say, day passes or just ride for a day or for a few minutes and don't really have the monthly and yearly passes, were grouped into visitor trips, which would be more of the tourists coming in. So you would actually see a difference in use pattern from the local users and the visitors. The local users, you kind of have more on the east side, sorry, the west side, right here, and close to Colonial Lake, Waterfront Colonial Lake right here, which is where most folks would go for lunch or a meetup, right? And then you also have the Hampton Park right here as well, right? So the local users were mostly on the west side of the peninsula, but when you look at the visitors, you kind of see that they're mostly concentrated on where most of the tourist attractions are on the peninsula. So that's something that's also really striking that we want to pay attention to, or we wanted to pay attention to moving forward. So some aggregation of our data shows that over 70% of our bike trips were under 3 miles on the peninsula, which makes sense. But this is a lot of our trips are within 1 mile, 2 miles, and 3 miles. So that's something that we thought was good. Just because by looking at the National Household Travel Survey for 2017, we had well, this is national data, but just looking at the national data, it's about 46% of trips are within 3 miles in the vehicle. So there's a lot of potential here to move some of these 3 mile trips in vehicles onto bikes or other modes, which would be great for congestion and other things. So we just thought we'd juxtapose this image with this and kind of look at what we could do with the 3 mile trips in vehicles. And there's a lot of potential to actually move some of these 3 mile vehicle trips to bikes. As you can see, most of the bike trips were doable within 3 miles, right? So with all the bikes aggregated to, or bike trips aggregated to the infrastructure, we wanted to take a look at how the infrastructure relates to the actual usage, right? So to do that, we calculated a bike level of service for the peninsula. Each link had its own bike level of service calculated, and we used the Sprinkle Consulting formula, which is widely used in the field. It basically takes traffic volumes, number of lanes, speed limits, right, some other factors in calculating a bike level of service, just similar to you would in, say, highway capacity, where you're looking at a level of service. This is a bike level of service criteria here. So with that being said, after calculating our bike level of service for the peninsula, looks pretty good from a local road standpoint, because most of the roads, local roads were A's or B's from a bike level of service standpoint, which means possibly safer and more enjoyable bike usage on those roads, less traffic, slower speeds from a vehicle standpoint. And then the C's were kind of in the middle there. And then most problematic areas would be the D's, because the E's and F's were main freeways or highways that really less likely to have bikes on the interstates, right? At the crosstown going through there in red. So those were not much of a concern because we didn't really have many bikers on there. But the D's, we did have a lot of bike usage, so we want to take a look at those. C's and D's, mostly D's, to take a look at. So some aggregation of our bike trips and counts based on level of service roadways. So the good thing is we had a majority of our trips on B's, A's and B's, but the concern were the high C's and then the D's with regards to level of service, when combined, gives you close to 35 and 40% from a bike count and bike mile statistic. So those were the ones we were pretty concerned about, because we want to make sure that the conditions were good for biking on those roads. Some more statistics. This based on roadway functionality. So whether it was a principal arterial, a local road, and again, just like we saw with the level of service with A's and B's, most of these are on local streets, which would be our A's and B's, which makes sense. But we still have quite a bit on minor arterials and major collectors. So that's something we again wanted to identify and possibly address. And just like we did on the first few maps, we looked at visitors versus local users, and you would surmise that maybe local users know the routes a little bit better and know the area a little bit better, so might avoid some places from a biking standpoint. And it does kind of tell a little bit, that you can see that in the D column, most of those riding in Ds are from the visitors group and not from the local group. All right, so that's something that also stood out that we would kind of like to highlight to the city as well. All right, so moving on to being specific about these roadways, most of what we saw was graphical and summaries, but looking at specific roadways, that's what the city would actually concentrate on and be able to mitigate any issues or actually make conditions better for biking. We aggregated and looked at which roadways actually have the most bike trips or mileage from a percentage standpoint. So King Street, kind of top 5 here, King Street, East Bay, Meeting Street, Maury Boulevard were kind of the high pullers here, and Ashley Avenue. And as you can see, they are mostly C's and D's. Maury Boulevard wasn't too bad. It was a B from a level of service standpoint. But again, the D's are of concern, and high C's if we had any there. And this was a table for all users. And then we actually split this up into local users and visitors as well, just because at least the different characteristics associated with these users from a local to a visitor standpoint. And you can see that the roads with the highest usage for either group changed a little bit, apart from King Street, but all the others were different from the very top. East Bay, King Street, Meeting Street, and Maury Boulevard were the same as the joint aggregation was. So that means that the visitors are actually driving these tables quite a bit, right? So we have a lot more visitors than we do local users of the bike share. To be more specific, we're actually looking at, on this slide, kind of looking at juxtaposing good high usage routes to poor high usage routes, and possibly looking at the characteristics and something to be able to present to the city. Most of these roads were local roads. On the good side, I think 1 or 2 that were a little bit higher usage from a car standpoint. And then if you go to the right-hand side, you have the poor routes from a biking standpoint, but still high, relatively high usage, right? Again, East Bay sticks out, so that would be the first thing we're going to look at, and Calhoun Street and Meeting Street were the other ones as well. So that comes to the end of what we did from a transportation standpoint. But there are 2 parts of the project where we're looking at physical activity benefits. Here, Dr. Huey, Dr. Kaczynski, and Dr. Bornstein had a major role in this part of the research. So with physical activity, again, there's 2 sides to biking. You're looking at physical activity, and you're also looking at a mode of transportation and possibly reducing congestion. So the physical activity side use the same data sets, but they actually use more data because it wasn't looking at individual GPS points, but a more aggregated data set. So we're able to kind of encompass more of the year than we did with the actual GIS analysis. Right, so here are some of the variables that were looked at. The ride ID is basically when you take the bike and you log in and you ride, that's your ID. But then there was a user ID, that's a membership type. We also were able to get the trip lengths, the duration of the trip, which means that we could calculate the speed of the trip, or the average speed, because it was tricky with the speed calculation, and I'll get to that in a second. All right, so as explained in the first slide with on the physical activity side, we did get distances and the duration, which helped us get the speed. And that would feed into a way to calculate physical activity, whether it's light, moderate, or vigorous And the main indicator was something called MET minutes, right? And this is a measure of physical activity that has been, there is a range that's been recommended per week. And these are national guidelines, right? And if you look at the bottom, it has 500 to 1,000 MET minutes, so physical activity minutes per week. And when we did our math, we calculated the physical activity MET minutes per trip. It was 161 per trip, and that's one day, right? Compared to 500 to 1,000 minutes per week. So if you were to multiply this, assuming you bike 4 times a day, 4 times a week, then you're within range of actually being within the national guidelines, right? So that's kind of what we're looking at from a physical activity standpoint. The average speed, as talked about before, encompasses everything on the trip. So if the rider would stop for some reason, it builds up in the time, although the distance stays the same. So the average speeds would be higher if not accounting for the stops, which are harder to do. So we just use the average speeds. But even with that, the MET minute calculation was very eye-opening for us. The average duration for each trip was 42 minutes. And we would notice that later on that the driving factor for these minutes and these distances were actually the visitors. Right. Okay, so let's take a look at the split between local members and non-local, which would be the visitors coming in. Is the distances were different. You can see that it's a higher distance for the visitors coming in because they're mostly taking a leisure trip, covering more ground. The duration's much higher for the non-members. And then the speeds are much lower because it's more of sightseeing, leisure, not in a hurry, right? But because of the time that they spend biking, the longer duration, they have a little bit more minutes there at the lower speeds. So again, splitting it up into the locals and the visitors, again, very eye-opening. And so we would have to cater for these groups, find a way to do that separately, but collectively at the same time, making the system better for all. So a few takeaways from the research. The first one was that the bike share system offers considerable potential to meet urban mobility travel for short trips, right? So that's why we're looking at the National Household Travel Survey trips and comparing that to what we did in our study, or what we found in our study with 3 miles or less. So that's a huge potential there. Bike share systems offer quantifiable physical activity benefits as we calculated from the MET minutes, from our average speeds especially, right? So it could be more, but because we're using averages, that would could reduce the MET minute calculation a little bit. So patterns of use were identified and would be something that could help the local transportation network, right? Some of the problems in there. So we did meet with the city. We also met with the Mayor's Wellness Council as well. And so the City Transportation and Planning Group, we have presented this to them. Again, it was eye-opening to them as well. So we're kind of looking at the next steps there. Bike share systems can play a meaningful role in achieving desirable urban mobility, congestion mitigation, and public health outcomes. So this was one of the overall goals of the research, and we can see that it is definitely contributing positively to this. And targeting our transportation network improvements to better accommodate bike shares. So that's what we're kind of talking to the city about. Some of these roads that are Ds and high Cs, how would we make conditions better or actually advise visitors on which routes to kind of take during their time here in Charleston, because the locals kind of seem to have a better idea of which roads to avoid than others. So that kind of brings me to the end of the presentation here. Again, a thank you to all that have worked on the project, and for C2M2 for sponsoring the project, and it's been a great eye-opening project for us as we look to round up later this year. So that's all I have for you guys. Thanks. Any questions? Open to answering any questions you might have.
Yeah, feel free to raise your hand or unmute yourself or put them in the chat.
Hey, Kweku, I will.
Hey.
Hey,
Saqib.
Hi. Yes, I will start with a question. I just wanted to know that what is your view, or what things you found that was that affected the bike sharing or biking people because of the pandemic? What are the emerging things, changes that are happening, and what will be the revised landscape in the future?
Yeah, that's a very interesting question. Since the data was before so luckily we were able to get the data before and did the analysis before. But I just been in touch with Gotcha Mobility by Bolt just recently. Obviously, the patents were down during the pandemic, but they have been picking up since then, and even they're actually looking at opening other avenues and other share systems, not in the state, but in other places. But I think what they're moving towards now, not necessarily from a pandemic standpoint, but what they're moving towards now are e-bikes, where there's research going on talking about the benefits of having e-bikes, which means that they have a pedal assist that helps in pedaling, which makes for longer trips easier to go longer trips, more rugged terrain, and with more enjoyable rides, and maybe have more people switch from cars to bikes because they're not exerting as much energy. But that's a little bit of a downside on the physical activity side of things. But I'm not sure what the landscape looks like from a recovering from the pandemic standpoint. I think just people are just easing themselves back into how they were doing things before, but we don't really have any numbers right now for that. Does that answer your question, Saqib? Or
yeah. Thanks. Yeah, that answers the question. Yes, and another thing is that, like, because at C2M2 we are heavily focused on digital infrastructure, with the connectivity and the real-time communication with different modes of transportation. So how do you think, what immediate things that can help? Like, we know that there are different safety and applications that can help the bikers, or so the pedestrians. And so what if you have a ranking, or what are the major things that can immediately impact the digital infrastructure system?
Okay, so yeah, I get the question. We haven't looked at a real time, but we did discuss possibly having an app, well, which would be real time, but possibly having an app, especially for those that are not familiar with the area, because some of these level of service D roads really have a side street right next to it, but they're just following the GPS or just following the main attractions from a visitor standpoint, and wouldn't know that it's safer just a block away, right, all the way across. So some kind of real-time app, possibly highlighting the LOSs that we came up with, and kind of pointing the user, especially visitors, to routes that would be more enjoyable to ride on and safer to ride on, but still being close enough to all the attractions they want to take a look at and kind of see when they're in Charleston. From a kind of a distant view into the future, some of these bike patterns and actually where people would ride could be incorporated into an algorithm for connected vehicles, autonomous vehicles, on a probability of having, well, not just bikes, but pedestrians kind of show up on the roadway or whatever it is. So I think there's a potential there from a programming standpoint for probabilities of having pedestrians or maybe bicyclists on the roadway. That was something that would help safety as well from a connected vehicle standpoint.
Okay.
And Kweku, if I could just chime in too. So
Yes.
so we have in the works for our community bus rapid transit facility, a spine that will connect roughly along the I-26 corridor from downtown Charleston out 25 miles to Somerville. And I think, you know, like this study would have shown the reliability that bike share has to kind of pair with a bus rapid transit and to get beyond the park and ride or the ability for people to simply walk from their points of destination or origin to the station. Now this goes out additional maybe 3 miles and begins to show like, well, this is some type of component of this bus rapid transit system that should be considered and then it frees up capacity of the streets. Another thing that the system does right now is there's a gigantic parking demand in this relatively small Charleston Peninsula area, and that's another benefit of the bike share is that you don't have to deal with the parking, and you get a physical activity benefit from it as well. So I think that where we didn't answer all the questions, or it is laying the groundwork up to kind of follow on and just the dialogue about what the value of this type of mobility and this type of mode can have. I think the e-bikes kind of emerged after we started the project, and then it brings something else, and then obviously the emergence of micromobility with the scooters are all kind of part of this. I feel like that, but one of the main things that we were looking into is that these systems are being just plopped down in all type of urban areas without any modifications to the infrastructure. And how do we make sure that the infrastructure is not a big problem for the safe use of this mode? And we were able to show that there are problems, and those problems really have solutions. And largely the providers, the mobility as a service providers, and the local municipalities don't really know where those problem areas are located. And without knowing, then you can't come up with a solution to make this mode more viable.
Hey, Captain Kweku and General Davis. Oh, wait a minute. Colonel, sorry, get my ranks. I have a couple questions. Hey, that was cool, Kweku, by the way. Hey, I do have a couple questions. One statement. First of all, with regard to what Dr. Davis was talking about, I think Graham Malone worked on that bike rapid transit study, and he's a grad of our program, and he's going to be talking about that bike rapid transit at the ITE ASCE joint upstate meeting in July. So I encourage you all to check that out. Kweku, I do have a question, and it goes back to the demand for bike share going from that's being directional. Like for example, on campus here, we haven't put our bikes out by the parking lots because they would disappear in the morning, and there'd be no bikes there.
Coming back, yeah.
It would end up, because it's highly directional. And so like for bike rapid transit, for example. So I guess my question is when there's a demand for bike, do you have information on bike availability and things like that?
So that's a yes from the user standpoint. So if you have the Holy Spokes app, you do have which hubs have bikes and which ones don't. I'm not sure how they move They possibly move around bikes in case there's a low level on one hub versus the other. But
right, I guess
something.
I understand that the app, but I'm wondering if do we know that if there's demand for bike, but they say, poo on this because there's no bike available, and that would be
that's something I think we looked into, but it shouldn't be hard to find out if we have their contacts and we're in touch with them.
Right.
So something that we can find out if we lost some trips because folks didn't get bikes at the hub.
right.
Yeah, zero.
And then the other thought I had was also, what type of bikes are they? Are they throttle bikes, or do you have to pedal for it to assist?
You have to. These are just regular bikes. So the e-bikes are new system that they're putting down, but we don't have them in Charleston yet. So these are just regular bikes.
Oh, these are the regular bikes. Oh, yes. I'm sorry. Yeah.
Mm-hmm.
Okay. So they're not the e-bikes.
Mm-hmm.
For e-bikes, there's two types. One is throttle, and
then one is pedal assist.
You don't necessarily have to pedal at all.
Yeah.
Versus, and then
I think the ones they have that we talked to them about were the pedal assist. So you have to start pedaling.
You have to start
We're
pedaling.
actually trying to figure out when does the assist kick in, but they weren't sure when the assist kicks in. Like, is it after? At what speed does it kick in? But
right. I gave one of those to my wife for her birthday, and it has 3 modes in terms of assist.
Well, one thing I would like to add is that this is kind of a cross-cutting area, especially when you start talking about physical activity and public health and mobility and livability and wellness. And when we wrote this proposal, I think there was some question is like, does this have this type of transportation have a role in connected mobility and multimodal mobility? And I really appreciate that Dr. Chowdhury and the center really helped us kind of make the point that it does. And moving forward with this project, I think is going to have some interesting outcomes. We're already building on these research topics to look at the e-bike and micro mobility as well. But I can't tell you how much I appreciate Dr. Chowdhury and the center, helping us describe, how this does have a role, and it is an important part of the solutions to mobility that we're looking for in our center.
I'm not seeing any new questions in the chat. So I'd like to take this chance to thank Dr. Kweku Brown again. We appreciate your time and all your work with our center. And again, check this out on our YouTube and all our other videos, because we've got a great resource there.
Thank you, Charlotte.
Yep. Thank you very much.